Hey guys, Andrew Romano here. I'm back again to talk to you about another topic that my team and I have been talking a lot about this month, which is how stress impacts fertility outcomes. I find this is a really interesting topic because a lot of people actually underestimate the impact of stress, and they're not quite certain about how stress actually impacts overall health and fertility outcomes. I'm going to be covering some of the key things we've been talking about. To start with, I think that a lot of us can actually relate that when we're feeling stressed, we might feel things subjectively, whether it be that we're feeling anxious, irritable, sometimes down in the dumps, or even feeling burnt out and fatigued, and we can't really get out of that pattern. And the impact is that a lot of these things are actually coming from some type of stressor in our life. It might be on a financial level, a physical level, work, sometimes personal relationships, and overall lifestyle choices can have a really big impact on overall health from that stress angle. What we know is that when our bodies are under stress, hormones, our stress hormones in particular, cortisol and adrenaline, increase in production, which leads to this fight or flight response, our survival mode. And when we're in this sort of mode, hormones that are related to reproduction, whether it be testosterone, estrogen, progesterone, are all decreased in production. And it's important in order for that fight or flight response that related to that stressful situation to be elevated so that we can deal with that stressful situation appropriately. The impact is when we're under stress like that, heightened cortisol adrenaline levels, reproduction hormones decrease, is that fertility outcomes suffer. We also know that when stress is at large for prolonged periods of time, it can cause hormonal imbalances, leading to reproductive health issues for both males and females actually. When it comes to males, stress has an impact, cause decreased sperm production, and also cause abnormal sperm production. For females, it can be that menstrual cycle becomes irregular, delayed, or even absent, which is not great for fertility. And for both partners, stress can cause a decrease in libido, leading to decreased frequency of intercourse, fewer opportunities for the sperm and egg to meet. Now, managing stress and the impact on fertility outcomes is actually simpler than you might think. It does take consistent effort and commitment though. When it comes to effectively dealing with stress, it's all about the fundamentals. To first of all, address the causative factors of stress, changing a lifestyle to actually self-manage stress, whether it be changing diet, work-life balance, exercise regime, all has a massive impact. And if all this fails, you're seeking some better support, then seek out care from a healthcare professional. And that's how you can get best results. Alrighty then, so that's just a really brief overview of how stress impacts fertility outcomes. If you want to learn more, check out my blog. Or even better yet, reach out to my team. We're here to help. Talk soon, guys.